Hello to everyone and welcome back to my channel. My name is Tommy. I'm a human nutrition student and researcher at the university. What I do in these type of videos you already know. I synthesize the lessons at the university. Then I explain and teach you the best and most valuable information I think you should know. This is the clinical nutrition series of videos, and today we're going to continue by talking about the refeeding syndrome and the bioethics of the clinic. So let's begin. Okay, so refeeding syndrome. The definition is the metabolic and electrolyte disturbances due to the reinstitution of nutrition after absence. So basically this syndrome happens when we were starving on starvation mode, and then all of a sudden we reincorporate a lot of calories. The distinguishing mark is the hypophosphatemia, and here I have to mention the Minnesota experiment in which they try to replicate this with men, leading them to starvation. So physiopathogy, we are in starvation mode, we have low nutrients in the body, and therefore we have to maintain the plasma levels using those nutrients. We have three main things here: hypokalemia, hypophosphatemia, and something related with vitamin B1, the thiamine. Let's view them one by one. Potassium, hypokalemia. Insulin, which is the hormone that is secreted by the pancreas to lower the glycemia when we are eating, will interact with the sodium-potassium pump because the glucose can use this pump to enter the cells together with the sodium. Therefore, insulin increases the entries of the sodium together with the glucose and the losses of potassium. Low potassium will create arrhythmias and weakness. And also the magnesium, hypomagnesemia, will worsen the hypokalemia. So guess what? We have to first treat the hypomagnesemia and then the hypokalemia. Then talking about phosphorus, which is the distinguishing mark of this refeeding syndrome, insulin again will trigger the glucose phosphorylation, because when we get insulin inside the cells, there is a phosphorylation of the glucose, so the glucose cannot really leave the cell anymore, and it can continue down the glycolysis to then obtain energy. And of course, this phosphorylation requires phosphate, and low phosphate affects the heart and lungs. Also, low phosphate will affect the hemoglobin, because in the hemoglobin there is this molecule called 2,3-bisphosphoglycerate, and as you can see it has two phosphates here, and this molecule is in charge of releasing the oxygen to the tissues. We have low 2,3-bisphosphoglycerate, low hemoglobin, and low oxygen to the tissues. Now let's take a look at thiamine. So vitamin B1, we have higher requirements of it. Deficiency leads to Wernicke's encephalopathy and the Korsakoff's psychosis, also to oculomotor abnormalities and a lower myocardial contractility, so the ability to contract the heart, as well as hydroxylene retention. So remember that, higher thiamine requirement, vitamin B1. Diagnosis, how do we know that there is a refeeding syndrome? The first thing is to think about anorexia nervosa. This is the most common one. Then also when there are mental disorders, alcoholism, because alcoholism lowers the B1. Also when there is a bariatric surgery, malabsorption syndrome, hunger strikes, and also this may occur in competitive athletes and in the military, as well as critically ill patients. So as you can see, this group is a little bit wider than expected, but the leading one is always the anorexia nervosa. The most cases come from this. An important clinical criteria is to use the specific anthropometric data sheets, so we can diagnose this syndrome in the early stages. Using the anthropometric data sheets, we can know if a person is prone to have this syndrome. And then the treatment. Well, we have to prevent. So early identification of the patient at risk using the diagnosis. Then we have to monitor the water balance, also the minerals balance, the phosphorus, potassium, the magnesium, the ones we talked about in the physiopathology here. Also, the daily weight is very important, as well as the cardiovascular balance of the individual. Then, after monitoring, we have to supply at 25 to 50% of the estimated needs. So this is like 10 kilocalories per kilogram per day. You have to know that normal people should eat around 32 kilocalories per kilogram per day. You can see this is quite low, but we are coming from a starvation mode. So we go little by little. If not, this syndrome may happen. Then we have to correct the phosphorus, the potassium, and the magnesium, and give 300 milligrams of thiamine per day. This is crazy amounts, 300% of the daily recommended intake, which is around 1 milligram. And this is because the deficiency is quite high. We increase the requirements. And also because thiamine is an hydrosoluble vitamin, and that means that it doesn't accumulate in the body, so it is not toxic. As a recap, we say that we first have to take a look at macros, then the calories. Okay, so now let's take a look at bioethics. Bioethics must be like, applied, intermediary, and procedural. The principles of bioethics are autonomy of the individual, so he or she can decide what to do with their own health. Beneficence, always providing health. Non-maleficence, so avoiding the disease. And there must be justice. The functions using bioethics committees for decision making. And these decisions are based on the clinical research and the healthcare ethics. Here we have to differentiate two things: the informed consent, which is the patient healthcare contract. And this applies to everything. The patient must be informed about what are the procedures, how they are made, and why they are recommended. On the other hand, we have the advanced directives. This is basically what you want them to do with you when you are unconscious. For example, you are in a life-threatening situation in which you are not conscious. Well, if you have written advanced directives, then the medical doctors must follow your decisions. To create these advanced directives, you must be competent, and these are signed by a notary public, which takes the responsibility over your competence. Now it's time to talk about nutrition. Is it a right or a treatment? Both. Nutrition is a right and a treatment depending on the individual, and it is based on beliefs and, of course, bioethics. Let's take a look at bioethics and diseases. In dementia, for example, we do not give artificial nutrition to demented people. We treat the pain and constipation, and the quality of the diet doesn't matter anymore. In Parkinson's disease, 20% of them have dementia, and they often have dysphagia. Therefore, they also have the right to the euthanasia if they want. In the amyotrophic lateral sclerosis, there is a respiratory failure and dysphagia. We use a ventilator and gastrostomy for these individuals. Oncology, we have a lower ingestion, and therefore we must provide them supplementation and high protein. Are they autonomic? Then they can get an informed consent or an advanced directive. Eating disorders, for example, the anorexia nervosa. It is a mental disorder. Here, the principle of beneficence overcomes the one of autonomy. This is simply because they don't know they are sick. They think they are fine. And this is the exception in which we give more credit to the beneficence of the individual than the autonomy. And then last but not least, there is the voluntary fasting. For example, a terrorist who is in jail and does not want to eat. This is respectable as long as it is not life-threatening. This also depends on the country. You are ready to die? Then we give you probes. So enteral nutrition to keep you alive. Again, all of these are based in the principles of autonomy, beneficence, non-maleficence, and justice. Okay, that's it for this video. You can find this diagram by clicking in the first link in the description down below, and you can download it from my website. Remember to like this video if you enjoyed, but you can also dislike it if you didn't. And tell me why in the comments down below. Subscribe to the channel for more content like this and share it to your friends and family if you think this information is valuable. Thank you so much for watching and I will see you in the next one. Hope you enjoy it. Ciao!